When Vincent Streech was diagnosed with lung cancer, he knew he would be in for the fight of his life. After his initial treatment failed, doctors gave him 1 year to live. Refusing to give up hope, his search for more diverse treatment options led him to Mayo Clinic.
For me, the reputation more than anything else is very, very well known worldwide. So we had pretty good knowledge of Mayo Clinic and how they worked.
Vincent actually had some treatment elsewhere before he came to see me. So his cancer had initially been operated on, and they were hoping that that would solve the problem. But unfortunately, he had some little tiny other spots in his lungs that over time developed into other tumors, a sign of metastatic disease. And he had already had some chemotherapy after the initial surgery. So this was the next type of treatment to do. And because we know that adenocarcinomas that have KRAS mutations don't respond as well to standard chemotherapy, he was an excellent candidate to go on to something new, especially something that was targeted exactly towards cancers like his.
Vincent says he and his wife Sandra appreciated having Dr. Ross and an integrated team of Mayo specialists working together on his treatment options, which included clinical trials. The couple says the depth of clinical trials offered at Mayo Clinic's Arizona campus was a big factor in their decision to choose treatment at Mayo.
The way I look at a clinical trial is that you've got great minds that are exploring different ways of treating things. Vincent's he's had very few side effects from them. He's been through 3 of them. The first 2 were not effective. The one that he's on now is. It stabilized his tumors. They aren't growing as much.
As Vincent continued his treatment, the couple were dealt another tough blow. Sandra felt a lump in her breast and was diagnosed with stage 2 cancer. The couple credit regular exercise and a positive attitude in helping them cope with going through cancer treatment at the same time.
We've been on his cancer journey much longer than mine. His whole attitude has been, I may have a lethal disease, and I may die, but not today. And I think that's an important way to approach any kind of illness that you have or any trial that you have or any horrible thing that might be happening to you or within your family, is that you have to have an attitude that I can get through this, and today I can be happy. Today I can be productive. Today I can make a difference.
Sandra also sought care at Mayo Clinic. Her oncologist, Dr. Donald Northfelt, told her she qualified to participate in a clinical trial that could potentially shrink her tumor.
When patients with that condition are seen initially, we typically think of surgery followed by post-operative anti-estrogen therapy to reduce relapse risk. However, at the time that she came for consultation, we happened to have clinical trials available that were testing new preoperative anti-estrogen strategies for the care of her condition.
Sandra was relieved the tumor shrunk and was able to opt for a lumpectomy procedure.
We've connected with the genius and the researchers with Dr. Northfelt, and I was fortunate enough to have an artist of a surgeon in Dr. Pachkai. It's just been a wonderful experience at Mayo. I don't think we could have gotten the same treatment, the same care that we got at Mayo anywhere else.